Hello. So today I am going to be talking about the hysteroscopy procedure setup as well as the dilation and curettage setup as well. I have the back table here. I didn't have a lot of instruments and materials that I needed um, for the setup for the both of them, but I just put out some index cards of the stuff that were missing. So basically, for the hysteroscopy procedure, that's gonna be transcervical. So basically, there's no incisions, and that's going to be done through the vaginal canal to get to the uterus. And they will be using the cystoscope, I believe that's how you pronounce it. Okay, so basically, that's the one on this side, back here. I'll show you what it looks like. It's actually this one right here. So the cystoscope with double bridge, that's the card that I have. But basically, this is gonna control like fluid if they do need to irrigate it, which they will need to irrigate, suction, and distend the uterus so that they can see inside of it too, to make it bigger, I guess you could say. But yeah, so that's the type of cystoscope card that I have. And again, it's for visualization of the uterus. So that's this one. So on top of that, they will also need different like instruments in case they do need to take any like tissue, like biopsies of any of that sort. I found a couple different ones. So like this one. So this is a grasper with tooth, so it'll have like a little pointy, there you go, like little teeth. So these are graspers without. Sorry, these are with teeth. These are still with teeth. Just want to show you. Okay, so this one is called an alligator. These are still graspers. Maybe I didn't grab any without teeth. But these are scissors. So then these are all gonna help the cystoscope collect any tissue that they will need for further testing to see if any of it is cancerous or not. This again is for the distension. I wrote this little like reminder thing. For this procedure itself, you don't want to use saline because that's gonna create an electric current when you're using the cautery devices, because they're electric, so it might even cause a fire. So anyways, yeah, so they're gonna use these as well. This is a fiber optic light cord. Again, that's for the cystoscope so that they can see to provide light. In the back, it does say fire safety. So again, just have to be mindful and cautious. These are just different like suction applicator tips. Again, because it didn't specify what type of suction applicators they wanted, but these are what was in my kit. These are all for suction. And you would just want to keep them in like 2 different like basin containers, just so you're not mixing like bloody bodily fluids with the distension / irrigation basin, because obviously you don't want to put something that's already contaminated back into the patient, because that'll just create an infection. So yeah, and then I also just set up some lab sponges and some Raytex sponges as well, because that's like what you would want to have on your table. So that section is done. And then you have the dilation and curettage transvaginal setup over on this side back here. So basically what you'll have on this side, I separated with towels. Again, this procedure is going to be transvaginal, so no incisions. This is done to like collect again like specimens as far as the uterus goes, just for further testing. So the instruments that are needed, you do need a uterine sound, but I couldn't find one. There was also no index card for that either. But I did find some tenaculums, and this is going to help hold the cervix. It did ask for different types of curettes. I found a couple different ones. And at least in the index card, it says they're for a different purpose. And again, this is all for like, you know, female reproduction, you know, vaginal uterus. So like for example, these are for removing adenoid tissue, which again, that's not going to be like in the female reproductive organs. This one you would want for sure. This is the uterine curette. And again, the function of these, they're going to scrape the inside of the uterus due to retained contents or excessive bleeding. And the reason why I got all of these out is because in my reading, it was saying that the surgeon might ask for sharp, blunt, or I forget what the other one was, but you know, just to have multiple kinds. So again, this one is bone curettes. I don't think, you know, the bone should matter, at least for this educational purpose. But again, this is used for like orthopedic procedures. In the index card, it's telling you that these need to be sharp in order to be effective. So that is why I pulled these out, because in the reading it said that they might ask for sharp ones, which is why I chose this one. So those are the curettes. I found some dilators. Again, it was saying different kind of dilators. It didn't say like one specific, so that's why I chose the multiple index cards. So these are called Heger cervical dilators. You got these are called Pratt cervical dilators, and then again it's just like for dilating the cervical opening. And then the last one, these are called Hank cervical dilators. So again, I just pulled them all out because in the reading it did say those names, but you know, they might all come in a set, and depending on the preference of the surgeon, on the card, I'm sure it'll tell you exactly which one they want. That way you don't have like 16 dilators sitting on your table, and that'll just create a lot of like clutter. Yeah. Oh, and I got these specimen cups. I just labeled it. But so I got these out because when they're performing the procedure, it's specified to put the tissue, biop, whatever, in the specimen cups. So I got these out for demonstration purposes, and you know, obviously we're gonna have multiple of these. And again, I just put out some more laps and sponges for the purpose of this video. So yeah, that kind of just concludes the little educational purposes of this video, and hopefully this was not only just educational but somewhat useful, because it was to me. And obviously I think the more you do stuff as far as like setting up or like seeing the instruments over and over, I think the more you get familiar with stuff, yeah. Thanks.